Joining us now is Dr. Deborah Birx, the Coronavirus Response Coordinator for the White House. Dr. Birx, good morning. Thanks for being with us.
Good morning.
Well, even though, as we have mentioned, New York and the nation recorded its single largest day in terms of fatalities, there is, in fact, hope on the horizon and a suggestion that perhaps social distancing is having an effect. Can you explain that?
Yeah, we're really proud of the American people. It looks like across the United States, people are following the guidelines, decreasing their social interactions, staying 6 feet apart, washing their hands scrupulously, using hand sanitizer, and critically, not going to gatherings more than 10 people. And I think the American people should be proud of the work that they're doing.
And how do you think it's affecting the curve? I mean, do you see the beginnings of a flattening of the curve, or are we frankly not there yet?
So each of these epidemics are sub-epidemics. So, you know, the New York metro area is different than the LA and Seattle area and Washington area. So Detroit, we're watching each of these, Chicago, each of them watching very carefully for where they are on their curve. And of course, New York and New Jersey, we know Washington and California started very early, went to social distancing very early. Their curves look like they are persistently flat, and that's very encouraging for us. Obviously, New York and New Jersey had what we call a logarithmic rise in the number of new cases, but we're seeing that stabilizing, and that gives us great encouragement. We know that we're seeing still the high levels of mortality, that people succumbing to this illness this week and potentially into early next week, particularly in the New York, New Jersey area. But that reflects individuals that were infected more than 2 to 3 weeks ago, even before some of the strict mitigation started.
Some models, or at least one, now predicts a number of fatalities that's much lower than that original number. I think you said right here on our air a couple of weeks ago that there could be 100 to 240,000 American deaths. Now some of the models that have better data, presumably, now that we have U.S. numbers, are predicting the number could be lower. Do you expect that? Do you anticipate that we might come in under that initial projection of 100,000 to 240,000 deaths?
We're very hopeful because of the seriousness of what the American people have taken these guidelines. What's really important is that people don't turn these early signs of hope into releasing from the 30 days to stop the spread. It's really critical, and you can see the delay. So if people start going out again and socially interacting, we could see a very acute second wave very early. So we are really encouraging every American to continue to follow the guidelines for these 30 days.
That really raises the question whether 30 days will be enough. If 30 days of social distancing will be sufficient to flatten the curve. I believe that one of the models I just mentioned that was optimistic does assume that the social distancing practices go until June. Do you anticipate that?
I think we're looking at data every single day, and it really, obviously we're United States, but each of the metro areas have a different curve. And so we're really looking to see which metro areas have really flattened their curve or coming down the other side and really progressing well with the social distancing. And then really learning from California and Washington State about how different releases could occur by geographic areas. So all of this data is coming together, and as you just said, data is critical. Models are models, but really understanding what happens in the United States is key.
Unfortunately, one of those trends suggests that the African American community in particular has been very hard hit by this virus. Why do you think that is, and is there anything that can be done about it at this point?
You know, we've been very concerned when we saw where the virus was going and the clear evidence from other countries that pre-existing conditions, particularly diabetes, hypertension, obesity, and asthma, were particularly difficult in the disease course once infected. So I just want to make it clear, we don't think African Americans are more susceptible to getting infected, but we do think with those number of pre-existing conditions, and this really brings us back to the social determinants of health, and I think once this is over, we really need to look very carefully into each of those items to really look at what it's going to take to ensure the health of all Americans.
Dr. Fauci said as recently as this weekend, just a few days ago, he said very bluntly, we were still struggling to control the virus. Is that the case? Do you still agree with that assessment?
Well, I think you can see how California and Washington have done. Those were our sentinel communities. Those were our first red alerts that this had reached a significant issue in the United States. And we're really watching them very carefully because they really have seemed to have really strong public health measures and excellent health commissioners that really are changing the trajectory of the epidemic in those regions. So that's what we're trying to learn from. Clearly, there are metro areas that are struggling, and I think that's when we see hospitals in their current state, we all have deep concerns, particularly those of us who come in the medical profession. So we are struggling in the metro areas with the number of people who had been infected a week or two ago or 3 weeks ago, and really working with them to ensure the maximum number receive the optimal care.
And just finally, I mean, we look and we see these heroes on the front lines, healthcare workers going in knowing they're at great risk of themselves contracting the virus, having to separate themselves from their own families in order to protect them, working tirelessly. As a physician yourself, do you have a word for them? Do you have a word of encouragement in this hour of need?
They are humbling to me every day. They make me feel like a humble participant in this entire epidemic. I know many of them. They are amazing, and you know, it's not only the nurses and doctors, but it's everyone in that healthcare delivery system, from the first responders to the respiratory therapists to the individuals in the lab to make sure that all the specimens get run. These are the heroes of America, along with the American people who are social distancing, so that those heroes can finally get a break in the next few weeks.
Dr. Birx, I know it's early. Appreciate your time this morning. Thank you.
Thank you.